Hello, my lovely people. Good afternoon, good evening, good morning, wherever you find yourself in this world. My name is, as you know already, Ask Your Midwife, your international midwife, health on wheels on all the various social media platforms, wherever you find yourself. Okay, so our topic for today is on labor. Okay, we have gone through the 9 months journey. Now we want to put to bed what we have in what our uterus. So when we talk about labor, we'll go straight into the point. Labor is just the painful rhythmic uterine contraction, okay, with the aim of bringing out the fetus and all that comes with the fetus. Okay, so the product of conception. Okay, so it's painful. Okay, and it's we understand what pain is, and it's rhythmic because it follows a certain pattern. Okay, and it comes with what's uterine contractions. Don't worry, I'll explain everything to you. Okay, so uterine contractions is where your uterus will become hard. What's in the layman terms, here I explain everything to you in the layman terms. The uterus is what you call outside this world as in this world as the womb. Okay, so the womb becomes hard. Okay, you feel that your womb has become so hard, and you feel it what at the top of your abdomen. Okay, on your abdomen. Okay, so your whole it starts from the top of your abdomen. So and it transcends down. Your whole abdomen becomes so hard. Then when it becomes hard, it comes with what? Pains. Okay, so what are the signs of labor? How will I know that somebody is in labor? The true signs of labor are the notice of show. When we talk of show is the phlegm-like substance you see, okay, in your panties with a little bit of what blood streams or blood streaks. Okay, so you see this phlegm-like substance with some blood stains in it. Okay, that is one sign. Then the sign that will follow is the uterus becomes what? Hard. Okay, that is what you feel on your abdomen. Okay, it starts from the top, then it radiates through the whole abdomen. Okay, then you have what? Painful lower abdominal pains. For some people, the pains can be just in the waist. For others, it will be at the back of the waist. For most people, it's what? Your lower abdominal region. Okay, so when you see that you have uterine contractions, okay, you see the show, okay, then probably you may be in labor. I'm saying probably because for some people it starts, then it will end for some time. But when it is labor, okay, it's painful, it's rhythmic, okay, and it comes with what? The show. The true signs of labor. It's rhythmic because when the pain is starting, it starts gradually, then this pain doesn't go away. Okay, so when it starts gradually, it takes some seconds, then it will what? Relax. The pain will what? Relax. The uterine contractions will relax. Then you are free for a while. Then it continues again at another time. Then you are free for a while. Then it continues again. So when the pains come and relax, then it continues for some time throughout the day. Then you know that you are what? In labor, with the notice of the show. I am not talking about breaking of the waters, because for some people you may be in labor, okay, but your waters will not break. For most of us, okay, for some of us, our waters break when we are on the delivery bed. The midwife would have to now come and break the water when the baby's head is coming, or in the process of labor, 5 cm, 6 cm, 7 cm, 8 cm. That is when you see that your labor, your water breaks. Okay, so if you see that your contractions are timely, I'll show you how to time it. Your contractions are coming with what? With time. Okay, it's time bound. Okay, we say that these contractions, it will come, then it will relax, Not long after, it comes again, then it will relax. Then you see the show. Then you may or may not see your waters breaking. That is when you are in labor. Okay, so when we talk about labor, we have 4 stages of labor. The first stage, okay, the first stage of labor, the second stage of labor. The first stage is when you are from tip dilated to 10 centimeters dilated. The baby is not out. We are monitoring you in all the aspects, okay, of the first stage of labor. Then we have the second stage of labor where the baby comes out, okay. Then the third stage of labor where we deliver the placenta, okay. Then the fourth stage of labor is where we do the monitoring. Now the baby is out, we are going to monitor you and the baby. So when we talk about stages of labor, we have 4 stages: the first, the second, the third, and the fourth stage of labor. I hope we understand ourselves. We have talked about the signs and symptoms of labor, where you have the painful rhythmic uterine contractions. Then it comes with notice of the show. I've shown you what the show is, okay. Then we have what we call the breaking of the waters, which may or may not, okay. When you are pregnant, there is this phlegm-like substance which is called the operculum that seals your cervix. It prevents ascending infections, okay. It seals the cervix. So when it is time for the baby to come, that operculum has to the mucoid plug has to leave the cervix, and that is what comes in the form of show. That's the phlegm-like substance. And when it's coming, it comes with streaks of blood, because the uterus is very rich. So once it leaves the cervix, it comes with a little bit of blood. So these are the signs and symptoms of labor. So why should I come to the hospital when I feel these signs? Okay, some people will tell me that I delay because I do not want to come and spend so long a time at the hospital, and I do not want the midwives inserting their fingers in my private part. For some people, they may be lucky. They will delay and come and give birth successfully, but others may not be lucky. Why? The reason being that when you come to the hospital when you are suspecting labor, okay, as soon as you come, we take your vital signs. So if we take your vital signs, your temperature, your pulse, respiration, your blood pressure, then we also check your oxygen saturation, okay. Then we take your glucose level. When we do all that and we see a deviation from the normal, we will correct it for you. But if you stay in the house and your BP shoots up, who is going to notice that? So you will be doing yourself a disservice. So whenever you see that you are in labor, okay, please, it's better for you to come to the hospital, for your midwife to tell you that, oh, this is not labor. We will guide you on the true signs of labor. If you are around, we tell you to just go and roam in your house, or familiarize yourself with the people in the house. Then you come back when the signs become so strong, okay. Then if you are also living very far, we give you a place to stay. Then we counsel you on the true signs of labor. I think it is fair, so that when you see that you are in labor, please just bring yourself, come and let's do even the basic checks on you. Let us examine you and see if actually it is labor. It's better for us to tell you that it is not labor than to go home, than be at home and be in danger. Please, do we understand ourselves? Okay, so having said that, what are the the first stage of labor is also divided into 2 parts. We have the 3 parts, sorry. We have the latent phase, the active phase, and the transitional phase, okay. The latent phase, the active phase, and the transitional phase. I'll tell you all that all that you are to expect in all these stages of labor. I do not want my video to be long. I want each video to be 10 minutes. So I have just introduced the topic to you. Let us meet up in my next video. Bye for now.